go. You want to get started? Hey, good morning, everybody. This is the Thursday, March 12th, 2021 Emergency Board of Health meeting. I'd like to remind everybody that this meeting is being recorded by audio and video. And pursuant to the Governor's March 12, 2020 order suspending certain provisions of the open meeting law, any Nantucket public body that holds a meeting will be a Zoom video conferencing. The video conference will be shown on Nantucket's government TV YouTube page. We ask for the public to participate in the meeting as an attendee. Attendees must register to participate. The registration link is unique to the meeting. The registration link can be found in the description of the Nantucket Government TV YouTube live feed for the meeting. People registering to be an attendee must use their names, otherwise they will not be allowed to participate in the discussion. Attendees will join in listening mode. They can click the raise hand button if they wish to speak. The chair will call on those who have raised their hands in the order they were raised. If you do not have an audio capable device, a Q&A button can be used to take a question. The YouTube chat will no longer be enabled. Any questions that cannot be verbally asked must be use a Q&A function. All questions should be directed through the chair. And for attendance purposes, as I see board members, could you just acknowledge that you are present? Jim Cooper.
Here.
Malcolm McNabb.
Here.
Meredith Lepre.
Here.
We also have Heather Francis.
Here.
Jerico Mele.
Here.
And Director Roberto Santamaría.
Here.
So we'll just move right into this emergency order discussion. I'll let Roberto start.
So at last week's meeting, we had a discussion about possibly doing an occupancy order, and I wanted to make sure we had that opportunity to have that discussion. So what it comes down to is over the course of the last week, we did have a small drop in viral concentration, not significant, but it is enough to bring the cases from a predicted of 40 cases per day to 10 positives per day. So I'm going to go ahead and share my screen to show the. So let me pull up the. Here we go. So when we move up to the top, let me page up here. What we see is the viral concentration graph. Even though we have gone from 40 cases per day down to 10 cases per day, you'll see that it's only a minute drop here in the concentration. This little section right here really kind of shows that the virus is here at almost the same concentrations as it was last week. We just don't have the same amount of people on island as we did last Monday, which is really what it comes down to. So we do still need to maintain mitigation measures. I'm not 100% convinced that occupancy is the way to go, considering that the sector-specific guidance for restaurants and things are still showing 75% in their occupancy numbers. And then voluntarily, a lot of some businesses are now starting to require proof of vaccination as well as negative testing. So I just wanted to have the conversation here as we go regarding occupancy numbers. Greg Corbo is out, so any decisions that we do make today, any votes that we do today, I will have to get to KP Law for them to draft the order, and then we can go from there. More than happy to just have the discussion here.
Okay, board members, Malcolm?
Yeah, I've thought a lot about this. I think I don't have a problem in an environment where everyone is masked, but I think there's a hole. I'm not quite sure how to fill. Masks are certainly important, and obviously the two most important things we need to do is wear masks and get everyone vaccinated. So maybe later we can talk about vaccination on the island, like how many people are vaccinated and so forth. But I have a question that'll help me a little bit, Mr. Chair. If the health director could tell us what's the source of most of these infections, given contact tracing, is there one particular source, one particular area where we should be focused on?
So from what we've seen so far is it's not the same. It's a lot more diffuse this time. Last time we were seeing very high concentrations between little households here and there. In this case, what we're seeing is in large gathering points. So a lot of our positives that we're seeing have come from where large groups of people have concentrated at a restaurant, at a bar, at a party, things like that is really what we're seeing a lot more of this summer's outbreak. And that's kind of the reason why you've seen some of the staff at restaurants getting hit with it too, based on catering events and parts like that. So most of the staff in, I think 3 of the restaurants now actually were hit based on a catering. So it was a private party. It wasn't at the restaurant itself.
Wasn't there? So it's, all right. So that's where people aren't wearing their masks. So in a restaurant, the hole I see is even if we have occupancy, say of 75% in a room, it's not going to help us if that's 75% is all at the bar without a mask. And I think that's our big hole. Is the mask order is important, but we're saying, you know, if I can belly up to the bar and take my mask off and drink and hug everybody. So how do we deal with that? That to me is the big hole. I mean, it's not sitting in a theater. It's not going to a store if you're all masked. It's where you take your mask off and with lots of people, and that's our bars. What do we do about that?
Well, we can issue sector-specific guidance. We can do that, sector-specific regulation. I would definitely want to have town council draft that if we do, because I don't want to step onto any discriminatory issues here. Not necessarily discrimination and any sort of racial issue. It's just when you treat one business different than another is when we start seeing issues, like some of the lawsuits we saw in New York and California last year
Right.
with the occupancy issues of churches. So that's a lot harder to do because even if the occupancy was down to 25%, you'll still get some gathering, which we saw at the parties at the houses last year. So you can't legislate human behavior, which is probably the hardest part here, because we're at a point where people say, we've been in lockdown for 18 months, I want to go out.
Well, I think, yeah.
I'm sorry?
I'm sorry, go ahead.
Well, what we can do is in under sector specific guidance from the state from phase 3, what we can do is adopt parts of that where they wouldn't allow bar service, where if they had tables at the bar, but you couldn't, belly up to a bar. You had to be at a table if you were going to get alcohol. That would be pretty devastating for the bars right now because there is no bailouts left, like the PPP loans. So that is pretty difficult.
Yeah.
We kind of need to balance that as well.
I think, like you just said, then now you're getting very specific and sector specific, picking on the bars. And a mask order that we just put in it's very clear. I mean, it isn't any different than going in and sitting down at a table. A lot of people sit at the bar to have dinner, not just belly up and stand there and drink. So, I mean, that's the way I see it. To put those other restrictions in now the way it was before, that's going to be a nightmare.
Yeah.
And as Jimmy said last time, we need to make anything we do simple. And that's why I'm very conflicted. Excuse me. I guess I'd better get tested. I'm just conflicted about this, and I know maybe we look for another week of the septic numbers. I mean, there is that little downward trend, but is it? We're biased trying to find good news, and I'm not sure that little downward tick is good news or just variability.
Exactly. What at the most, what I would call what's happening now is a plateau, not a drop in a spike.
Right.
What I like the idea of waiting, give it 2 more weeks. That's what it will take for masks to really start taking effect. This may be an artificial deflation of numbers. The masks may have had nothing to do with this.
Right.
We don't know yet. It's the confounders that we're looking at.
Right. Yeah.
We are going to see which we are now, a big drop in the workforce population, especially college kids that are, have jobs. They're already starting to leave in the next 2 weeks. I'm sure a lot of places are going to get devastated with staff. So that's one good thing about numbers dropping.
Yeah, the numbers are always tough because even we look at the percentage of positive tests, it all depends on the denominator, how many tests are done. So that can be very artificial as well. And I think, maybe 10 cases a week or 5 cases a week is what we're going to have for forever.
Yeah, that's actually another good point. Keeping it at around 10 I would say is closer to an acceptable number if we can maintain 10. If you remember, at this time last year, we were talking about maintaining it at 1 to 5.
Yeah.
But because we know where we are now and we know how to treat it now, 10 is closer to an acceptable number. We do need to keep an eye on what's happening in the rest of the state, because when we do helicopter people off, we send them to Boston most of the time. So that's one part that's really important to keep an eye on. We do know that even vaccinated people who are coming down with Delta are starting to show symptoms, and those who aren't vaccinated are showing severe symptoms at a much higher rate.
Right.
So one good thing that, if anything, that came out of this spike that came up is that we have had an exponential increase in demand on vaccines. So we went from averaging around 70 vaccinations, and Heather's, you're smiling right now. We went from around 70 vaccinations on average per clinic to, what was it, 144, Heather? 142 in one per clinic. So it's definitely increasing the demand, which is great. which is great. What we want is to get people vaccinated because we're no longer in the fight to stop the spread. We're in a fight to slow the spread down. And vaccines do that. Masks do that too.
Yeah, well.
Must throw in on that too.
Mr. Chair, just so I hate to procrastinate, and I just like to make a decision and a recommendation, but usually I'm a little more specific in my thoughts. I just wondered what the other board members think. Jimmy and Meredith.
Jimmy, go ahead.
Have you had anything from the restaurants themselves? Have you had any calls, or have they come up with any ideas, or how do they feel about this whole thing? They know about it now. So have you heard from any of the restaurants on what they think?
So it's been a mixed bag. It's definitely been mixed. More positive than negative. What we, in a good sense, not positive rates. What we've been getting is some people are saying absolutely it gives us more teeth to be able to enforce, which we do need to tweak something from last week's wording wise. It gives them more teeth to enforce and helps them say, look, you need to wear a mask because the government's saying so. We do have the occasional people who are saying it should have been up to me. And I do get that. I understand that businesses want to control their own businesses. Absolutely, I get that. So it's really what we've kind of come down to. But by and large, the bulk of people, and we have restaurants coming in here, a lot of restaurants owners coming in here a lot asking for testing. We gave out 3,000 antigen tests in the last 10 days. And we're out. We're officially out. We're still waiting for the state to give us more tests. And by and large, most of them were restaurant owners or managers coming in asking for antigen tests. And they are pretty positive about the mask order. Jerico, if you want to throw anything on that?
Yeah, additionally, we had a couple of plans to sort of establish a pooled testing system that we could then do regular screenings using the existing the Binax kits. Unfortunately, the particular kits cannot be adapted in that role, so we won't be able to provide kits for regular screening. Additionally, we're looking at the next soonest we could get more kits from the state would be Monday at the absolute soonest. I think is probably a realistic estimate for that. And those would be, 1,200 kits at a time, which at current rates would be 4 days, maybe.
The other thing is, Jerico, do you have a number on how many people have been hospitalized to medevac? Did the state give us that? Did the hospital give us that?
They're tracking down the most recent numbers I had when I checked at the beginning of this week. I think there were 3 medevacs and 1 local hospitalization. I don't have any more clear information on that, but I'll be getting that together.
Meredith?
So I just have it sounds like people are getting it from gathering outside of businesses. Is that like private? And we can't really do anything about that. But I do think, is there a way, since the state probably will not send down a mobile testing unit, that they could really just fire off a lot of tests to us? And also the antigen tests, I have heard of restaurants just getting them and testing everyone that works there, which is great, except that if they have a low viral load, they're not going to test positive. So I have some concerns about the antigen test. I have had concerns about it since the start. I know they wanted us to use it in schools and they want us to use it. And it's, in my opinion, a little bit of a bogus test in comparison to the PCR. So we could be giving people these antigen tests to do on all their employees and say, yay, everyone's negative, but really they're not. They just have a low viral load. And also, is there a way to give the restaurants, because it just seems like every day more restaurants are falling, and are they giving guidance of like, this is what you need to do, or are they just, because I just think it would be helpful for us to be able to say, like, if you get a positive employee, then like, this is the list of things that you need to do. It sounds like everyone's been doing the right thing. I just don't know if the state's giving guidance anymore on that.
So most of the most of the protocol questions for restaurants come either through me or through our inspectors. And we've got a pretty solid set of requirements for them to go through. So when those restaurants are when they're closing or when they're deciding to open or they're deciding what their next step is, we are generally in the loop on that and can advise them on how to do things. Unfortunately, the guidance is constantly moving on this. We've had basically 2 180s in a row from CDC in 3 weeks. So what's valid right now is not necessarily what's going to be valid next week.
To help with the other issue that you were bringing up with antigen, which you're absolutely right about, is we are in the process of looking into the feasibility of using ARPA funding to possibly get our own PCR machine as well, to help with specifically, like you said, schools, because of that issue. Because of that particular issue. So if we can get a hold of a PCR exam, we would be able to handle some small batch issues, probably once a week or so, just because it's really expensive to run these. But we can do, like what you were saying last year, some of that pool testing at this point. So if ARPA, if the US Treasury does approve the PCR purchase, we should be able to move on that within the next month or 2 or a month.
So could we offer businesses like pooled, I mean, maybe it has to be antigen testing, I don't know, but pooled testing, like if they say, we really want to stay on top of this, and different companies say, can we do pooled testing once a week? I know that the state is paying for schools to continue doing that for free for however long. Would that be something the town could do for businesses? Like, we want to do pool testing once a week on all our employees, and then
once we get our sea legs in, once we get some practice PCR with the new PCR machine and process and logistics, really, we could probably start offering that as well, because a pool test is a good way of showing.
great.
See, Melissa's jumped in. Did you want to?
Thanks, Steve. No, I'm not weighing in just yet. I'm sorry, I had a work emergency, but I'm here listening to the conversation. Thanks.
Did you want to add anything else, Jim? Any other questions? Anybody else? Any other? Malcolm?
No, again, I don't want to have 2 topics at once. They're sort of related. Again, I like a sense of the immunization rate on the island, which, as we talked before in numbers, that's probably impossible to really know because we don't really know how many people are here. But there's been some controversy about that. I just wonder if you could clarify it for us.
So it's our biggest issue. I've actually been talking to one of our resident demographers on this. You may know Mr. Morrison. A few months ago, a month ago now, where I asked specifically, is there other ways of figuring out a population other than looking at wastewater usage, water usage? And as of right now, for our purposes, not really. It's a much larger process, and it's going to take a long time. And usually, when we're looking at the summer population, perhaps the only way we'd be able to really do that, and I spoke to Remain about this last week, is to redo what the data platform did in 2017. Really study what the cell phone pings at a specific period of time on specific days or over a specific week so that they can average out the amount of people that were here. Cell phone data is probably the most reliable population best estimate we'll be able to get without doing a full demographic study.
Are you even in a qualitative way, not quantitative, comfortable with our present vaccination rates?
Qualitatively, yes. I know so the Brown Shoe Group is showing their analyses again, accusing us of not using proper population. Nobody knows the population here. And what we've been saying from all along is that approximately a little bit over 50% of the island's year-round population has been vaccinated fully because there are people who got their first vaccine in another country, in another state, in another municipality, and then came here to get their second dose with the Janssen vaccine out there. We've also given a bunch of that. So even one dose of the Janssen vaccine counts as a fully vaccinated individual. So we have approximately, Jericho, correct me if I'm wrong, about 10,500 or so people fully vaccinated, which is a little bit over 50% of what our year-round population would be. I would like to see that number get closer to 65 before we can really start, for, like what the Brown Shoe said to us in the newspaper, declare it over, which is never going to be over. We have to learn to live with COVID for the next few, decades. I think what we just have to do is get first critical mass of people vaccinated, and then seasonal vaccines after that, like the flu.
All right, so just take the official census population, and then you can brag that you have 90% of us vaccinated.
I think we're at like 111% of the 2010 census numbers. So we've vaccinated more people than exist on the island.
I'm sorry to diverge, Mr. Chairman. I think we go back to occupancy, but I've been trying to figure out running the numbers myself, and I just got a headache.
What we're starting to reach, though, is we're hitting kind of a critical mass among those who are 12 and older. That extra 15% we're not going to really hit until the Pfizer and Moderna vaccines get full approval for ages 5 and older or 2 and older, which I know Pfizer is looking to do. So once that hits, we're going to see another bump in vaccinations. We won't be hitting 100% of all the children out there, but we will see a large amount of people getting it. So if we get even 50% of the children vaccinated, that'll get us to that 60% that we're really looking for.
Jimmy, go ahead.
Roberto, is there any way that we could push a program that people would go along with it? You can't get into a business, you can't get into a restaurant unless you have your card saying that you had your shots. I mean, how do the businesses feel about that now? Do you have any idea how many businesses are using that practice?
So far, I only know of 2 businesses requiring it. It's good to see that businesses are voluntarily requiring it, and we would encourage a business to do that, but I would discourage us from requiring it. I don't think the government should get involved with somebody sharing their personal health information. But I do like seeing that. The Chicken Box in Cisco Brewery is now asking for a requirement. It is a good way of making sure people are lowering transmission. Will transmission happen? Absolutely. Absolutely. But the vaccine knocks symptoms down by at least 70%, sometimes even more, which knocks transmission down by approximately 80 to 90% by some of the preliminary studies that are showing. So if you're not asking for vaccine cards at the entrance, you're looking at a transmission risk of approximately 30% when you're looking at non-vaccinated and vaccinated people and potentially shedding. When everyone inside is fully vaccinated, you're looking at a transmission risk closer to about 10% or less. That's with some of the preliminary information that's out there. So I do like seeing that, but I don't think we should make a requirement for it.
Anybody else? Melissa, did you?
I was going to be rude and maybe ask if there was any recap of recommendations that I missed in the first part of the meeting for our consideration today. But I don't want to waste the board's time.
Yeah, absolutely. I can do two recommendations because I never actually really gave a full recommendation.
Okay, thank you very much.
So I think what we should do is twofold. One, I think for as far as occupancy goes, we should wait at least another week, maybe two, while we see where the sewer data is going. But the other one that I would request some help on is we need to tweak some language on last week's emergency order. We need to amend it a little bit. We put in there that fines or enforcement will only go to the person. And we had a little sticking point with the clerk magistrate about that, where it should also say to the person and or the business entity, so that we can enforce fully on both lines. And then we can always refer to a sector-specific guideline or add in a definition of when there's an event under a tent, what counts as outdoor, which would mean that 50% or more of the flaps are open on a tent. Because once, as far as the definitions through like the building department, through the state's DPH and things like that, once all 4 flaps are put down, you're considered indoors. So we do kind of need to throw that into the emergency order from last week. So I want to see if you guys are okay with that. And there's also a conversation request from the gyms. For example, something like a spinning studio specifically. The spinning studios from the state perspective are still at 50% occupancy so that they can maintain that 10 feet distance between groups. They're wondering if they can have their masks taken off during a spinning class once they are on the chair. Everywhere else in the gym, on the weight room, things like that, they should still be wearing a mask. But on the actual cardio machine that they're doing, they're asking for that consideration as well. So I want to get your ideas first before I share my screen and get to work on the emergency order.
Melissa?
Thanks, Steve. I guess I do, thank you for that, Roberto. I do have a question. With the businesses who are voluntarily requiring vaccination status, I've not spoken with many of those business owners, but how is mask compliance going? Because those are, I know, Gaslight, Chicken Box, they're indoor, more nightclub, bar atmospheres. And I'm just wondering how the public's responding to that, how they're doing with managing it, and if there's any recommendations around that. It feels like we've made great progress in a week just based on the sewer data in slowing things, right? From 40 cases to 10 cases in the prediction. That seems like progress to me, but is that, and then my second part of my question is of great concern to me. And I understand that vaccinations and masks slow the spread. And Roberto, I know you and I have had this conversation, but I think it's important for the public to hear and weigh in on it. Our kids are, and Mary knows this better than anyone, our kids are going back to school in the next couple of weeks, and it's a highly vulnerable population. So even though I'm congregated with people who are vaccinated, and I could potentially get enough virus, not even have symptoms myself, and spread it to more vulnerable people. So I just wanted to be clear on the objectives of the policies recommendations and also how they affect our most vulnerable populations, which is, I think, the ultimate goal of anything that we're doing right now, because as you said, COVID is not going anywhere and we can't eliminate it. But how do we best act to protect people? And I just want to add also, as a personal note, it continues to confound me as a policymaker because so much of COVID is personal responsibility and personal choices that people make. And for example, I have an autoimmune disease. As much as I love to gather indoors, I'm choosing not to do that right now for my own personal safety. I also work with people who have young children, and I want to be conscientious of that. So that's my personal choice and my personal responsibility. I take that seriously. I want to be careful that we're not overstepping our policy making, but also doing the best we can to protect the most vulnerable folks in our community. So thank you.
Absolutely. The recommendation is always, if you come into contact with immunocompromised individuals or people who cannot get the vaccine, which includes children under the age of 12 or other people who have had allergic reactions. If you're a person who comes into regular contact with them, you shouldn't be going out anyway, regardless of vaccination status. You shouldn't be really congregating in large groups because it's such a high risk situation for particularly those groups of people. We're hearing a lot of misinformation out there from social media and public comments from other meetings as well that say children aren't affected by this. Well, that's not true. Delta is affecting children pretty severely now. And it's really important to start paying attention to that. And they're seeing symptomatically and hospitalization-wise and death rates identical to adults now. So it's, when people start saying only 1%, and with children it's less than half of 1%, that's not true anymore. It was less than half of 1% for wild type COVID, not Delta, and even less for Lambda, which is also coming down the line.
I see you. Yep. Go ahead, Meredith.
Aren't they saying that Delta is as contagious as chickenpox?
Yes. So nationally in the United States, the R of Delta has hit 7, which is twice what wild type COVID was. And chickenpox is an 8.
What is our R number now?
Our local R? Oh, I haven't calculated that in a while. Damn.
I haven't asked in a while.
I haven't calculated that in a bit. I'll have to get back to you on that. Well, let me calculate it and I'll email it out to the board and I'll throw it onto the packet for when it gets into the minutes.
Do you want to get to the amendment of the order?
Steve, could I just ask one more question? I'm sorry, before we go to that. Roberto or Jerico, is it possible for us to, as we are looking at the COVID positive information, have it broken down by age group so we have a sense of that age demographic that is affecting our community?
It is theoretically possible, but again, the more granular you get with the information that you share, the closer it gets to identifiable information, which especially in the when you're dealing with age categories can be a little bit of a problem. We are going to be probably starting tomorrow doing a more teased out version of our daily reporting with all of the data, including all of the pendings backdated into it. I can look at adding more data to that longer term report, but that's going to depend on a lot of factors outside of my direct control.
Okay. Through you, Steve, just for me, I think it would be helpful to understand who are the most affected populations. And and I understand, there's so nuanced and it's very different than giving us the information even 6 months ago, because we could have a lot of positives, but they're positives in vaccinated people, meaning they're not symptomatic. And so, we're looking at different data, but, most specifically, I'm kind of curious in that age group of 19 and under, or even 12 and under, what are those numbers looking like for us as we're moving into the school season and talking about protecting that population?
So I can give you some insights from other states that have hit this earlier, and all of the states that have been dealing with Delta for over like 3 or 4 weeks. They're all seeing basically it's the people that's hitting the worst are the unvaccinated, all unvaccinated, roughly equally. And then we're seeing, as schools are starting up in other states, we're seeing significantly increased transmission over last year and the pre-Delta variants in schools. I will dig a little deeper and try and get you some specific numbers from those states as kind of a preview of what might be the case here.
Thanks. You want to go to the order amendments?
Good. So with the emergency orders, what we would do is type in here. Today. So what we can do here is in the order. Oh, I've just realized that it's not zoomed in. My apologies. Physical distance and effort is under enforcement. Let's see where we are. So here, and this portion. And then over here, percentage of guidance. And then over here, we would add the gym part. I don't know what the board thought about the gymnasiums, the sitting at cardiorespiratory equipment. What was your thoughts on that?
It's Melissa. Roberto, I feel like I have to defer to you about what the safety is in that situation. Even if the bikes are 10 feet apart, air circulation is our best friend in prevention of the spread of COVID, as I understand it. And so I'm a little hesitant to make an exception, even with the bikes being 10 feet apart, because in my mind, it just doesn't make sense that that's enough protection if a positive person was in that room. Is that enough to protect the other people from potentially getting exposed?
Absolutely, I'll defer. I think the board is, I'd be happy to do either way.
I mean, would they be willing to make sure I would be more comfortable with it if everybody was vaccinated.
I agree, Mary.
If they're not asking vaccine status, then I do think that it's more of a high risk activity because people are going to be working out and they're higher risk of transmission, I would think.
I would agree with that too.
I'm okay with that.
Okay. Malcolm, I saw your hand up. Malcolm, you're muted.
I just don't want us to get to a situation where every week we start putting more exceptions in here.
That's a good point.
I think from a health perspective, I'm concerned. I like the idea of vaccination, but in 3 weeks, this order will be 20 pages long.
Very good point.
To Malcolm's point, then I would say we should probably, leave the order as it is as far as that, instead of just, right, each week, somebody else coming in looking for another exemption.
Could you repeat that, Steve? Was this, because I think you suggested what I was just going to suggest, but I had competing noise in my ear.
Well, I just said, maybe we should just leave the order as it is, and you're going to have to wear your mask indoors, and instead of each week somebody coming in looking for an exemption, whatever business that they're running, we could just keep on changing this every week.
Yeah, and I guess I agree with that. I also think, we talked last week about being nuanced. Every business does operate differently. And, if we wanted to consider some rule for businesses that are self-imposing a vaccination requirement for entry, would we across the board consider no masks so that we're not necessarily business specific? And that part feels more risky to me, but I think to save us from having to adjust this order to be specific for each different type of business sector, for right now, it may be best to just leave it the way that it is. But again, I'm not a scientist. I'm a community member, volunteer, policymaker, so I really have to rely on Roberto and Jerico and Heather to say, this is what we think is going to keep the community safest, or this is okay. I'm going off of my layman brain.
You bring up an excellent point. Especially Malcolm brings up an excellent point that if we keep looking at it every week and start carving out exceptions, we'll be looking at a 25-page organization order that nobody knows what's going on with. Chances are, let's be honest here, with the way the outbreaks are going across the country and across the state, I wouldn't be surprised if Governor Baker starts issuing sector-specific guidelines within the next few weeks to months, especially coming into the fall.
Yeah, so let's just leave it the way it is there and see, how things go in the next couple of weeks. I would say you're correct, and he's going to do something.
Do we need a motion to do that? If we do, I make a motion to leave it as it is.
Well, there's
yeah, I was going to say, maybe we make a motion to adopt. Could you scroll down, Roberto?
I still haven't
amendment.
added the second amendment.
Okay. Okay.
I haven't added the next amendment about the definition of indoors. So what we can just do is just, if you don't mind, I can throw in the definition as, let me just throw in here. Does that work?
Yeah.
Makes sense to me.
Any structure.
So but just to be clear, if I'm in a tent and one side is down,
25%.
right. If two sides are down, then I'm technically indoors. So that's going to be really important for event planners to understand as we head into event and wedding season. If there's inclement weather and sides have to come down on a rented property or,
Correct.
right, not private property, then masks have to be on.
Does this work as for everyone as amendments?
It does for me.
So, yeah,
Good for me.
Okay, so the amendments that we have here, let me just pause sharing so I don't give people motion sickness. Scroll up here. Is the amendment of the date, the exterior, the definition of indoor that we just did, and then this little section here. Those are the only amendments that we have. All right, is the board okay with this?
Yes. I move that we adopt the amendments to Article or to Order 16 as noted.
Second,
Second,
all in favor by roll call vote? Meredith Leffery,
Yes.
Melissa,
aye.
Jim Cooper,
yes.
Malcolm McNabb,
Yes.
and Steve Visco says aye.
Okay.
So then, as far as, why we met today on the, the occupancy part that we discussed earlier, and I think we're going to vote on something. I think we kind of like agreed to wait with your recommendation.
Yeah, I think we have the Board of Health already scheduled for August 19th. It's already scheduled for next week at 4 o'clock on Thursday. So we can revisit this at that time.
Does that work for the rest of the board members when we meet next Thursday?
Works for me.
Yes.
Meredith?
I just have a quick question. Are we, is the town going to be putting out more signs around town about the mask mandate for?
Yes. So as soon as we voted it in last week, we put it in order. The public information officer is developing a new outreach poster, and then we're going to get it to Poets Corner. So we'll be printing them out any minute now.
Great.
Just an add-on to that, having PDF files available for people to download and print themselves was an excellent tool, and getting our friends at the chamber to help share that and any other business organization is super helpful, because sometimes they can just click and print themselves. It was a great tool last year.
No, it works. Yeah, we'll get to work on all that. I believe that we should be printing them out anytime soon. Anytime now.
Is next week's meeting via Zoom, or are we in person?
We're moving to Zoom again, just because of the community room issue that we're dealing with right now. So we'll be moving to Zoom for the time being.
I also think that, if we have to be indoors with masks, speaking into the microphones is hard enough. I think for the public benefit, it's probably clearer to hear everybody through Zoom until we feel more comfortable. Just a suggestion, but I think it's important the public can hear clearly whatever we're talking about.
Absolutely.
So we're tomorrow's meeting, we won't need that you scheduled. That will be.
Yeah, it'll just be on the. I'll put it at the end of the agenda so that people who have variances and things like that don't have to sit through the whole meeting.
Any other questions or comments from the board? Okay. I get a motion.
I did.
Oh.
Are we taking public comment today, Steve? There was an attendee who has a hand raised, and
So please, Steve.
Sure, why not, I guess.
Nickole, please unmute yourself.
Hi, guys. Can you hear me?
Go ahead.
Hi, Nickole Tara here. I spoke at last week's meeting and I just wanted to follow up on a couple of points. As a reminder, I'm a member of the year-round community of Nantucket. I'm also a senior executive at a live events, music and sports company. And I wanted to make you aware of an announcement that we are making to the broader community later this afternoon. My company, in partnership with Live Nation, our competitor, are getting ready to announce a vaccination requirement for all live music venues to be started on October 1st and moving forward for all of our publicly ticketed events. And we came to this conclusion after compiling a myriad of outside data, scientists, doctors, physicians, community members. It is not a decision we are taking lightly whatsoever. And so I think some of the comments, Roberto, that you were able to make at the beginning of this call were super interesting in that it seems as though the community spread within Nantucket seems to be isolated to the bars and nightclubs and points of obviously mass gathering in a context of drinking and consuming food. And what I would encourage this board to take is to take the direction of what we are doing in conjunction with our total industry and consider an adoption of a similar mandate for those bars and restaurants, but in doing so, eliminating the mask requirement across the board, certainly for the businesses that are not being perpetrators of spread. So what we know from the data, and I think you will all well agree, is that vaccinations work. And what we want to do as an industry is encourage the adoption of vaccination, not disincentivize it. And what we know as an industry is because of the many loopholes of when you can and cannot take off your mask within an indoor space, that masks do not work. It is specifically shows. I would encourage you to consider that today and to make comment around it. Secondly, I would ask of you that you consider some thresholds to which you will rescind the mask mandate and agree to those numbers that you feel are safe for the community, and so that there could be something that this appointed board is held to as a community standard of which the public can measure kind of how things, the levels of which going forward and when we can see those things ending.
Okay, thanks, Nickole. I think this board's going to leave the mask mandate order until we deem it's necessary to remove it. And we'll meet as necessary when we decide to do that. We'll talk about it at our next meeting next week. So thanks for the comments.
With that, I'm happy to make a motion to adjourn, Mr. Chair.
Second.
Second. Okay.
Second.
I'll provide a roll call vote. Meredith Leffery. Melissa Murphy.
Aye.
Jim Cooper.
Aye.
Malcolm McNabb.
Aye.
And Steve Isco says aye. Thanks everybody for coming. We'll be in touch.
Thank you.
Thank you.